We are proceeding with our vaccination efforts, and that gives us great hope. And whenever you look at our vaccination efforts, if we've previously been vaccinating in Category 1B of the age 70 plus age group, and today I'm pleased to announce that we will be lowering the age group eligible for vaccination to 65 and plus. And if we can look at the graphic, we can see that Phase 1B is expanding effective today to the 65 plus age group. This will add 115,000 new Arkansans to the roll to be vaccinated. This is a large chunk, but we want to keep the demand for our vaccinations active. We want to make sure that as we make progress in the 70 plus, that we keep the lines filled, and we're moving it to 65 plus makes sense. This will be available, these vaccinations, through our community pharmacies, our clinics located in every county. We can call ahead for an appointment. I want everybody to bear in mind that this does not mean that everybody 70 and plus has been vaccinated, because they haven't. We have largely vaccinated our and made available, at least for the first dose, for our teachers. Our emergency workers have been vaccinated. Those in the nursing homes have been vaccinated, and these have been made available to them. And so we've made broad swaths and progress in these different categories in 1A and starting with 1B, but there's always more to do in those categories. But it is time to move up to 65 plus, and so you'll have to be patient as you call for an appointment, and the pharmacies are working very, very hard to make sure that they get as many doses out as they can. And that leads me to the report on vaccinations. If you see in our state program, we've received 794,000 doses. And the reason we're down at 63% now is because we just received 102,000 doses. Within the last 24 hours, we've given out 13,000, so obviously the dose percent goes down somewhat. Our federal programs, our federal partners include CVS, Walgreens, and Walmart. They continue to give out doses and increasing their availability as they completed their long-term care facility program. And so the total doses received in Arkansas, 855,000. Total doses given, 534,000 in round numbers. And so we're in Phase 1B, age 65 and older. And I would emphasize that as you look back when we started this vaccination program, we wanted to get through Category 1B by the end of March. Now, we're not necessarily ahead of schedule, and we got a lot of work to do to keep up with that schedule, but that still remains our goal. And then I did want to make another announcement. As I spoke with the coronavirus task force of the Biden administration today, I've been advised that we will increase nationwide our doses by 1 million. That will be in addition to our current allocations. For Arkansas, that means that we will be allocated around 4,000 additional doses that will then be sent to us next week. But that is good news, and that's guaranteed increase for over the next 3 weeks. The retail pharmacy program will also receive nationwide 100,000 additional doses, which means that the state program is getting the largest bulk, of course, of the allocation, because we're distributing statewide, emphasizing our priorities and both efficiency and equity as well. As Dr. Romero will be working on this weekend, and if the emergency use authorization is issued by the FDA for the Johnson & Johnson vaccine, then this would mean that next week we could see another 2 million doses available nationwide, which would once again increase the doses that are available in Arkansas. So part of raising or lowering this to 65 plus is looking ahead to the future as to what we see as an increased supply.